We're live.
Yes.
And it's not a manic Monday, it's a gorgeous Monday here in Southern California, Christy.
The weather's been fabulous.
So we thought we would just spend a few minutes over our lunchtime.
Yes.
Georgia is here and she's very chatty
Is
today,
she?
so we're going to see if she has a lot to say about EMface,
Well,
doesn't she?
who doesn't? It's my favorite thing.
But I'm Dr. Melanie Palm, Medical Director and Founder of Art of Skin MD. I have the glorious Christy Cashman, who is one of our non-invasive body contouring experts. And I would say in California, at least for sure in Southern California, has been doing EMface the longest and probably one of the highest volume providers of EMface. So we thought we'd do a little brush up because we've got body boot camp starting next month.
Yes, coming up. So super important to get in for consultations now so you have a plan for what you want to purchase for body boot camp. All our beautiful specials for all the body treatments that we do, and then the PAs also have some treatments on there that they do. So
basically any of the devices we use to help with body contouring, skin tightening, so things like EMface, EMsculpt, we'll have cool sculpting specials, skin tightening with things like EMtone, Exilus,
right.
Exactly, and then we do have packages. Our sculptor packages are always very popular. I use that for collagen stimulation, for body applications, and then Radius. We're also doing some specials. I've had a couple patients last week came back. We've done Radius on their arms.
So nice.
One is getting ready for a special event. I thought she'd have to do 2 sessions. She already looks phenomenal. So we decided that just one session, a little dab will do her. And the other one just already really significant improvements in that, sort of crepey changes in the skin laxity people get. So there's a lot that we can do. We had a fabulous physician with us last week, board certified dermatologist. She's doing fellowship training up in Canada and was with us for a Southern California experience last week. And I think she was really taken aback at our approach to, not necessarily in the same day doing a bunch of things, but our combination approach. So, using you for muscle toning or fat reduction or some sort of skin tightening, and using some of my talents to help with injectables on that side. And that's where
smoothing the surface, kind of.
Yeah. So we thought we'd talk about, something I use a lot with injectables, I think, my premise has always been sort of globally treat the face, treat a lot of the perimeter of the face, use fillers just very judiciously as accentuation points, things like the lips, or if we need a little teardrop, or if we need just a little pop to the cheek, but not using that so exclusively, but using collagen stimulators like Sculptra and Radius. But 2 years ago, we got EMface, and we have been a part of a study, and I cannot wait if you will join us in March, in early March. We've actually put it up on my Instagram. I'm going to be lecturing along with Dr. Sebastian Codafana, he is the preeminent professor of anatomy and physician that has written hundreds of papers in aesthetic sort of indications, understandings of anatomy. But the two of us, along with a lovely British cosmetic surgeon, we are going to be talking about the newest application for EMface. So I can't say what it is,
so exciting.
But you definitely want to tune in for it. And I cannot wait. I am a patient that definitely wants this new indication. So maybe we can talk about the 3 current indications for EMface.
Absolutely.
And you brought the applicator.
I did.
So you can use it even on my face if you want to.
Perfect. So we have 3 areas that we can do at this point. The first 2 that came out were the forehead. So we do a little treatment of the forehead, and then...
Or 5 head.
Or 5 head, yes.
And there's 2 different sizes,
there
right?
are 2 different sizes.
So if you're a 5 head like me, the regular applicator is great.
The regular one works on most everyone.
And there's a more petite one if you've
is.
got a more petite forehead that we can use in our smaller patients.
Exactly. And then we've got our cheek. We do one on either cheek. It just sits right here. And what these are going to do is raise the frontalis muscle, tone the frontalis muscle, and then tone 3 groups of muscles in the cheeks, the rosorius, the zygomaticus major and minor. And then, and those are all lifting muscles. So you're going to see an improvement in the brow position. Sometimes we even see a little more lid afterwards. On the cheeks, you're going to see an improvement in the nasolabial folds and marionette lines, a sharpening of the jawline, and then even I see patients get a little improvement under the eyes when they lift the cheeks. The hollows don't show as much as they're camouflaged a little bit. And then, just not too long ago, about
6 months or so,
we have now the submental applicator that fits right under here. And what this is going to do is tighten this little tiny muscle here called the digastric muscle, which holds everything kind of up and back and gives you that nice little angle here.
Yeah, cervical mental angle. So it helps sort of tighten up like the floor to the mouth.
Exactly.
Yeah.
It's beautiful. So that again helps sculpt the jawline. But the nice thing about this little applicator is it gets a little bit warmer than the other two. So it actually removes a little bit of subcutaneous fatty tissue under here as well. So if you have a little double chin, this is going to help that as well.
Yeah, and you can tune it because the radio frequency is different.
Exactly.
It's a different setting than doing the high FES, which is the high intensity focused electrical stimulation, which causes the involuntary contractions to the muscle. So if you're someone like me that, say I started to notice this getting a little wonky and I wanted to sharpen up that angle, we probably wouldn't instill a lot of radio frequency on me. We'd want to control the depth. We'd want to do it superficially, so I just get the benefits of collagen generation, which is like over 20% with this, elastin generation, which we know is like 129%, quite significant, which gives the bounce back and elasticity to the skin. But we wouldn't be exploiting, if someone has pinchable skin, then that's where you're really turning up the radio frequency.
It just got that little extra volume under there. Then we would put it all the way up.
So 4 to 6 sessions. How do you decide how many sessions people need?
So we kind of customize just depending on how their aging is going, how their facial laxity is. But in general, on a patient in their 30s and 40s, I'll do 4 treatments, and they can be done anywhere from 2 days to 14 days apart. On somebody over 50, I normally will end up doing at least 6 treatments, and that's just something we kind of discovered going along doing the treatments, that patients with a little bit more laxity just needed a little zhuzh at the end.
And our eldest patient has been in their upper 70s. They are still extremely active. They do something in a professional sphere, periodically, and we have just been wowed by their photos.
It's amazing. Yeah, the lift that she got here, the lift she got here, and even just the quality of the skin looks amazing.
That's great. So like you were saying, I mean, if we're doing, so someone like me that's kind of in maintenance, but say I hadn't had treatment, things are in a good space. Like I'd probably be more for,
she'd be a 4.
Someone with more laxity issues, 6. So
like me.
If I was in a time crunch, 4 sessions we can do twice a week. We Monday, Wednesday, or Tuesday, Thursday, or Wednesday, Friday, and we could get it done in as soon as 2 weeks. And we typically start to see results at 1 month, but you see them back at 3.
I see them back at 3. That's when I've seen sort of the biggest jump in improvement. And so we'll do your before and afters. And so at 3 months, you'll see most of the improvement, but they did a study that showed that even up to 6 months later, you're getting more improvement up to that point as well. And then another study showed that at 2 years, since it's only been out about 2.5 years, that they're still seeing the benefits at 2 years later.
That's great. And then I will be very excited. I'm sure we'll do a demo on me because I really want to be a patient. So when we have this new indication, which I know I'm being a little squirrely about, but I'm sworn to secrecy. That'll be, I think, a really exciting addition that we'll definitely want to do a separate episode on. Talk about downtime, how long the treatment is.
So nice. There's no downtime with this treatment at all. There's no bruising, no needles. You don't need to numb for this treatment. It's a 20-minute treatment, so super easy to fit into your schedule. Patients are pink for maybe 20-30 minutes afterwards just from the heat. But other than that, I throw a little Hydrotint, a little tinted sunscreen on you afterwards, and you can just go right back to work or errands or whatever you need to do, and nobody will know.
And I don't, it's not a painful procedure. You feel some warmth from the pads, and then the sensation for the forehead for me, since I've had neuromodulator, it feels like almost like a caterpillar crawling. And then in the cheek area, just I'm scrunching involuntarily, kind of like
smile.
that. I have not had under the chin, but I've had it described like kind of corkscrew.
Yeah, exactly. So under the chin, it's probably the more
intense.
Uncomfortable. One, if you can call it that. You really do get used to it very quickly. It's just an odd sensation, so it's just uncomfortable at first because you just don't know what's happening. But it's more like a twist under here because it's such a tiny little muscle, whereas here it's more, you feel the contractions.
Broad.
Right, exactly.
So we just wanted to give you a quick little sort of preview. Our body boot camp will start in March. It will run for 2 weeks. It's a virtual event.
Yes.
We'll do a little Instagram live, so we'll go over some of the best and brightest in
Yeah.
terms of devices and offerings that we're having. So look for that on our website. We'll definitely shoot out some newsletters and have things on social media. But very, very exciting. I think, you know, especially in light of there's so much, I must have a conversation a couple times a week about patients pretty young talking about surgery and talking about invasive things. And I think they definitely have their place, but I think, you know, if you're a 35 to 45-year-old person and seeing some of these sort of just facial droopiness, this is a way to sort of, doesn't preclude you from having surgery, but I think offers a lot of improvements that maybe if you're not quite what I would consider a surgical candidate, and I love, you know, working hand in hand with our facial plastic surgeons in the area, but you know, this may be sort of one of those stopgaps for you. And so we will be here to answer questions. We're at lunch break, but are here Monday through Friday. You can call us at 858-792-7546. Our handle for the Art of Skin Body is
Art of Skin MD_body.
Yep.
So look on our Instagram, you'll see our specials coming up. You'll see some before and afters of patients. So I have a bunch of those on there. But really come in for consults early so we can really tailor a plan for you. And you can mix and
bridal
match.
season and Mother of the Bride is coming up, and if you're going on summer trips or special occasions or reunions coming up, I think now is the time to really focus on that, so we have that full exploitive 3 months to get you
tuned up.
Yeah, so thank you guys.
Thank you.
If you have any questions, certainly welcome to give us a call or drop us a note either on Instagram or through our website. That's a really easy way to get a hold of us. But we'll let you guys enjoy the rest of lunch, and I'm going to turn off our tune.